know one of the biggest things that we do here is hormone replacement therapy. I think a lot of patients don't really understand that that is like a foundational therapy. And if you don't have that, it's almost like nothing else works. Even with the GLP-1s, like these are miracle drugs. These have changed people's lives. But what you find is that once you get into that maintenance stage, if you have any type of imbalance in your hormones, that's when things start to fall apart again. So like what do you target, when it comes to hormone replacement therapy? Is that something that you recommend or?
Yeah, definitely. I think, it's important to let the patient know that a lot of times, the GLPs work, and patients see tremendous weight loss with them. But when they don't fix the other things and they come off the medication, the weight just comes right back off. And you'll hear
Mhm.
horror stories from patients talking about friends or themselves, and it actually comes back worse in what, I've experienced. So yeah, number one is telling him the number one most important thing is let's look at your hormone levels. Then let's go through that subjective analysis. Let's put it all together for you and get those corrected and remind people it's just returning them to the optimal levels. So not going
Exactly.
above, just right in that therapeutic window of where they need to be for a healthy, functioning adult of their age.